Donning a sterile gown and gloves. Purpose: to reduce the risk from transmission of microorganisms by the droplet contact, airborne routes, and splatters of body substances. Assessment 1. Check that the sterile glove package is dry and unopened. Also note expiration date, making sure that the date is still valid. 2. Review the principles of sterile technique. Planning 1. Wear complete or attire. Proceed to the assigned or room. Take gown and gloves. Pick up gown by neck edge. 2. Step 1. To feet away from the sterile field to have an adequate working space. Facing the sterile field, unfold the gown and expose the hemline portion. Dry your hands and arms with this small portion. Continue unfolding the gown and locate for the armhole. Position gown so that you are facing the wrong side of the front part of the gown. 6. Slip your hand into each armhole and your hands and arms straight and obliquely upward. Stop and swing your body to the right, then to the left. The circulating nurse will catch the belt on its ends as you swing. Gloving closed method 1. With fingers within the cuff of the gown, open the inner sterile glove package and pick up the first glove by the cuff. Using the non-dominant hand, work the fingers into the glove and pull the glove up over wrist with the non-dominant hand that still remains within the cuff of the gown. Position the glove over the cuff of the gown so fingers are in alignment and stretch the entire glove over the cuff of the gown, being careful not to touch its edge. Fingers remain within. Use the sterile gloved hand to pick up the second glove, placing it over the cuff of the gown of the other hand, and repeat the glove application process. Assisted serving others 1. Pick up the gown directly from the table. When serving the gown, your gloved hands should come in contact with the right side portion of the gown under the protecting cuff made. 5. Show the opening and armholes to the surgeon. Show the opening and armholes to the surgeon. 6. As soon as the surgeon inserted his hands through the armholes, leave it. The circulating nurse will fix it. Open assisted gloving 1. Holding the right glove open with the palm facing toward the person being gloved. Stretch the gloves well. Allow the surgeon to explore the finger hole. When the surgeon moves or jerks his hand downward, release your hold upward so that the cuff of the gloves covers the cuff of the gown. Working in sterile attire 1. Keep your hands in front of you and above waist level, below axilla. 2. Do not turn your back on sterile field. Pass front to front or back to back with others in sterile field. 4. Change attire when contaminated. And 5. Warn others of your movements.
如果有一天我走了，你会像马达那样找我吗？
会啊。
会一直找吗？